welcome everybody. I hope everybody's having a really good week. I see a lot of familiar names on here and some that I don't know. I know we've got folks from the Dobines Wealth team as well. So for those who don't know me, I'm Mark Deering. I'm Senior Executive Vice President here at Southwestern Investment Group, and I lead the Deering Wealth team. Thank you for taking time to attend today's webinar. It's a really good time to learn about Medicare as we got open enrollment just around the corner here on October 15th. So to give a brief overview, I'll just share a little bit before the expert takes over. But Medicare, as you all probably know, it's our country's federal health insurance program for people age 65 and older. People who are younger than 65 with certain disabilities or health implications may also qualify for Medicare, but if you or someone in your family is approaching 65, it's beneficial to learn all the ins and outs with this program because it can be one of the more challenging things to navigate. Jim Hurd is our special guest today. He's a licensed agent with Healthmarkets. He'll be leading the webinar today, and he's going to discuss Medicare Parts A through D. He'll walk through the enrollment timeline, application process, all the key considerations and that you need to be thinking about when it comes to Medicare and the open enrollment period. Feel free to type any questions. You'll see a little Q&A tab. It should be at the bottom of your screen. So type any questions as you go throughout the webinar, and at the end, we'll have a little Q&A time, and we can walk through any questions that you have. So I'm going to, without further ado, I'll hand it off to the expert himself, Mr. Jim Hurd. Jim, thanks for being here. And if we can get Jim unmuted.
There we go. There we go. Thank you, Mark. Thank you, Jeff. Appreciate the opportunity to talk about Medicare. I love Medicare. As you can see, I'm in Wisconsin. I'm about ready to do the 10th hole at the Ryder Cup. So I'm just in between discussions, I'll be able to do this Zoom call. I'm just kidding, but I thought it was a great background for and apropos for the day. So thank you very much. And yeah, I love Medicare. I love talking about it. And if I get too long-winded, you can cut me off, Mark. I'd appreciate that as well. But this is a time when open enrollment comes around and people can get really anxious about it. And I think television does that to us. Go, go, go. And I think we can learn to do this at our own pace by finding people to keep us calm and to know the ins and outs, what to do. And hopefully I can provide that for you today. I'm going to take my video off so not distracted to that. And hopefully everyone can see my screen. Can you see my screen, Mark?
I can. You're sharing it right now.
Perfect. All right. So I'll go. So this is me. And in fact, this is my best picture you'll ever see of me. So we'll go with that from now on. First, I want to just do a quick disclaimer that Healthmarkets and its agents are not employed by or affiliated with Southwestern Investment Group or the Southwestern parent company. So I am just hopefully a more favored partner in the vendor business that helps understand the Medicare side. And I appreciate everything that the Southwestern Group does to help us do a great partnership with your clients. A little bit about me before we get started. I'm a licensed agent in the life health, and I'm across the country. I'm in 22 states. I have more than 10 years experience in this, and I live in Nashville with my 3 kids. You may know my oldest son and daughter, Brian Hurd and Maren Morris. My son, Zach, works there at the Southwestern office, and my youngest, Amy, works at the Predators. So we came here 5 years ago and said, what are we doing in Kansas City? Let's move to Nashville. Since then, we have 3 grandkids, so we're having a great time being part of our family here. One of the reasons I got into advertising was about 11 years ago, my son died in a car accident. And because of that, I wanted to move from advertising, which sells people on something they may not want, to be able to help and tell people about things that they do need. And I think Medicare and myself and Medicare really had a nice bond there. And it was something that I felt like we could do a really good service for in the future. So from then on, I've been concentrating in Medicare. I work for Healthmarkets, and that means that basically I'm a independent agent, a 1099, and I use Healthmarkets to help me get contracted with the different insurance companies. So the long list of the best companies in the market is my market. So I do that, and then I work with Medicare Advantage plans, Medicare supplements, and Part D plans. Excuse me. One of the things about being able to be in 22 states and technology has really made that possible, so that we can do these Zoom presentations, we can do telephonic, we do email, and for most of you today, we can do in person if we needed to. So, and I'd be glad to do that. If there's any questions after this, if there's any more detail, or you want to just go over it again individually, I'd be glad to help you out and do that. So let's get into Medicare. I hope that some of you, this is a repeat, that you've probably seen or found a lot of data about Medicare, and I get all of my information from Medicare.gov, at least the majority of it, and this is how we formulate it to get it as simple as possible. So Medicare is a federal program. It provides health insurance for health coverage for 65 and older, as Mark explained, or severe disabilities. Doesn't matter your income for additional coverage. There's a lot of flexibility in Medicare, and their products really come from two buckets, and we'll talk about that as well. So Medicare used to be 4 parts, and now it's 3 parts, and you'll understand in a second. So the 3 parts are Part A, and Part A is something that you'll get after you've worked 10 years or 40 quarters at minimally, and that's something that you're entitled to. So you're paying your FICA in every month, and that pays for Part A. So when you do turn 65, Part A is entitled. It's not free, but you don't have to pay for it anymore because you've already paid for it over time. Social Security didn't put the doctor's side into it, so they wanted that part of it to be paid for or co-paid for, if you will. So there is a payment, a monthly payment for Part B, and that's the doctor's side. So if you go to Medicare.gov or SocialSecurity.gov and you look up what is the description of it, just to prove to you that I'm taking all of this from Social Security, which handles Medicare, is hospital insurance and medical insurance. So it's basic. Those are the basics of all of your medical that you're going to need. Majority of your medical that you're going to need for the rest of your life. So A and B pulled together, that's called original Medicare. You have to have B in order to be entitled to anything else within Medicare, which is basically that 20% coverage. So original Medicare was designed to do 80% of our medical, cover 80% of our medical. That leaves 20% to us. Now, when we're younger and we're making money and we're continuing to make money, 20% doesn't mean much. But as we get older and we maybe are on more of a fixed income, or we're not bringing in as much as we did before, that 20% could be a lot. And because of the way our bodies age, it also could be a lot by the amount that we spend in the hospital. So that is an asset management, and that's what I am in here to do, is to help protect that 20%. The third part is Part D. We'll talk a little bit about that, but D is the drug portion, and Medicare does not cover the drugs. And you can imagine why. Drugs are just all over the place. They're a can of worms that need to be handled separately. So they give it to private companies like Cigna and Aetna and Humana and all those, and they have to cover the drugs within the auspice of CMS or Medicare. So they have to be in that line. But there are private, and so they get to determine how much each of the drugs cost, and I'll talk about that a little bit more later. So in order to cover that 20%, there's really the old Part 4, or as previously known as Part C, which is the Medicare Advantage plan or a Medicare Supplement plan, and I'll talk about the differences of that as well. So again, we're really talking about that 20% when we talk about the Medicare Advantage or the supplement. That's what we use that for, is to cover off that the best we can. All right, so let's talk about Part B. So A, you got your Part A, and it's entitled to you. So you got it for free. You got your card, and A is paid for. Now, what is B going to cost? Well, there is a monthly fee. This year, if you got into Medicare this year in Part B, it will cost you $148.50. If we're now looking at 2022, I don't know what that new number is, but I'll know after October 1st or maybe the 15th. That number is going to go up, and it probably will be in the 150 range. So something 155 in that range, and I don't know what it's going to be, but they always go up. So most people pay that standard B premium amount. However, if your modified adjusted gross income on your taxes on your tax return from 2 years ago is above a certain amount, you'll pay a standard premium, which is the $148.50, and an income-related monthly adjustment amount, which is the IRMA. We'll call that IRMA from now on. So that IRMA is just an extra charge added to your premium. So this is the actual chart from Medicare that covers what you will pay and what category you're on. So you can see that if in the middle column it says file joint tax return, if you made over $176,000, you would go into the second category or row, which is $207. Now, the $207, which you see right here with my pointer, is not in addition to the $148.50, it's the total amount. So it's $148.50 plus $59, and that's what you pay. So this isn't like, it's not, this is cumulative. So this is the total amount you pay. And you both would pay that. If you file joint, you're both going to pay this number to the right. So those are always good to know. It's not really part of what I do, but I want to tell people that this is a key aspect so that when you do retire or you're ready to do Medicare, you know what level you're going to be on. If you have an IRMA in your Part B, as in boy, you will have an IRMA in your Part D, as in drugs. So your drug part. So you'll also have that IRMA. So you can see it works the same way. If you make over a certain amount of money, it goes up a lot less dramatic. Only $12 for one level, and then you can see how much they go up accordingly. So the most you'll pay for those who did $750 and above is $77 more a month. So just to let you know, those are the two aspects of Part B that you need to be cost aware of for the coming up for buying Medicare Part B. So one of the questions I get a lot is, if I hit 65 and I still want to work, do I have to get Part B? So the answer is no. If you're still working and you have your group insurance from your work, you don't get Part B. If your spouse has group insurance and you are covered under that, you don't need to get Part B. And that's why I wanted to show you the costs first, because there's no sense getting that cost right now, especially if you're below the first category. You'll just double dipping. So if you keep the group insurance as long as it's affordable, I want you to know that they have to be credible insurance. So if you're working at an employer that has less than 20 employees, they're going to look at that pretty stringently, and the coverage has to be as good as Medicare or better. So that's why group insurance is good, because it's been subsidized. It's a really good insurance. When you get into Medicare, it's good and it's proper to get into, but if you're in a smaller company, you may not have that good of insurance. So that's why they want you to move into Medicare as soon as you can. Also, if you're on a Christian coverage like a Medishare or something like that, that's not credible coverage. So you'll need to get into Part B as soon as you turn 65. So if you're in the top portion of that, you will not be penalized if you have that. Now, if you're not in that and you don't get Part B, you are going to be penalized for every month that you did not get into that. So we'll talk about that as well. So to sign up for Part A and Part B is very simple. If you're turning 65, you can do it online. It'll take you about 10 minutes. It's a very simple process. If you go, the first thing you need to do is get your Social Security account. Make sure that you go into ssa.gov, my account, and set up an account. And for anybody that is computer savvy and that's part of it, and I know many of you are, that's a very easy way for us to get Medicare. And even if you got your Part A, do it through that way. The second way is to do it the old-fashioned way, which is still a very good way to do it. There's the people are getting better and better as we get out of this COVID, and you can go call your Social Security office or go. Some offices are open a short period of time, but most of them is over a telephone meeting, and you can do it that way as well. Now, if you've already gotten Social Security and you're under 65 and you're coming up to 65, you might get your card automatically. And what that means is that at least 4 months, you can see at the bottom here, at least 4 months before you turn 65, you will automatically get a Part A coverage, and you'll also be signed up for Part B. Now, it's important to know that if you are on Social Security and you're still on your spouse's insurance, you don't want that Part B. So you have to tell them, please don't give me that Part B yet. I don't want it yet. So this is just something that Mark and Jeff's group are going to send you. They're going to send you this presentation, hopefully, and this just gives you slides to show you where to go, what to click on. The key here is to click on Apply for Medicare Only. I don't cover Social Security, so basically, if you're going to go in there, do Medicare Only. And basically what that says is, I do not want Social Security benefits yet. In there, you'll say whether you want A or B, A and or B, and then you go from there. So it will be very quick if you answer the questions when you're turning 65. Now, if you've waited, and you're 66, 67 or whatever, or you're planning on waiting, this process is very simple. It may be tedious, but it's very simple. If you're enrolled in your Part A and you want to start getting into Part B, you just have 2 forms, and I will send these forms to both groups. But you just complete these forms. You can get them on Medicare.gov as well. And these forms are really important so that you don't get penalized for being late. And it's a very simple process, because if you have this form, everything is clear, copacetic, and everything will be smooth. The first one is 40B, and that's for just the fill out that says I want B. It's a very simple form. It just says hit my name, address, and my social, and here's what I want to be now. The previous one is L564, and that's the most important one. And the reason why it's the most important one is because it tells the company, it tells Social Security that I had credible insurance from the day I turned 65 until the time I want to get Part B. So that's what you're going to fill out, and your employer or whoever gave you the insurance is going to sign this to say, yes, you did have credible insurance. And if your spouse is on insurance for the spouse's work, they need one as well. So you only need 2 of them when you're going to quit that insurance. This is the most important form. So if you don't get anything out of this, this is it for people who are going to wait and not not retire at 65. All right, so that's the A and B side, and we'll talk at the end if you have more questions about that and those processes, or you can call me. I'll give you my number and my email after this. So that's A and B. Part D is the third part, and again, that's the separate part of it. We're going to get more and more medications as we get older. Hopefully you won't, and you'll be blessed that way, and that's awesome. But Part D is the drug part. And the key part about the drug part is that it's a separate carrier. So it's almost like you just have to get another insurance, either at Cigna or Aetna or Humana or whatever. That's the name of the company, and they determine what how much each of the drugs are going to cost by the tiers. Now this is something that you don't have to get. It's not legally, you don't have to get this, but if you ever want it and you didn't get it when you got Part B as in boy, then they're gonna give you a penalty for every month that you didn't sign up for this. So it gets very expensive, and it'll be on there for the rest of your life. It doesn't cost a lot to be in a Part D. So let's just say I have Medicare only and I want Part D. I mean, the carrier costs range from $7 to $15 on the lower side. So it's not expensive to get into something like this. Anyway, so they determine which tier they're going to be in. And we're going to talk about this later, but if you get a Medicare Advantage plan, Part D is in that. That's why it's a Medicare Advantage plan. It's all folded in. If you get a Medicare supplement, you have to buy this, like I just told you, as a separate carrier. These are the formularies that they go by, the generics, preferred generic, all the way down to specialty. I'll go into this a little bit more on the next slide, but basically the cheapest one is tier 1 and the more expensive ones are tier 5. And by having that, you won't have to pay a deductible on tiers 1 and 2 in 99% of the plans, but you will have to pay a deductible in 99% of the plans for tier 3, 4, and 5, and that ranges from $445, down to $0. Like I said, the plans cost anywhere between $8 and $126, and I would never tell you to buy a $126 plan unless we really got a great deal on that, and there's something that benefited that. But we can usually find most of the generic and lower level drugs on the $8 to $17 plans. Now, I did learn something and in 2022 that is off the record, even though we're being recorded, is that your deductibles will go up from $445 to $480 in 2022. So that number is going to go up just a little bit. So that's Part D. So now let me just talk very briefly about the donut hole. That's what we've all talked about, and it's always thought about is when I hit the donut hole. And there's a lot of people who get surprised by this. And it's right about now in most of their cases is the donut hole. And the donut hole is really the third stage of the plan structure that Medicare put together. You can see the first stage is the deductible stage, which I talked about, and the member pays 100% of that. And not all plans have a deductible, but most plans, if they do have a deductible, only have a deductible for 3, 4, and 5. You see the initial coverage is when we cost share, and that's when we get to that initial coverage limit. Until we get to that initial coverage of it, it's you cost share that. So that's basically where you pay between $0 per month up to, it could be hundreds of dollars. But when the ICL includes everything the member and the plan pay. So basically you're talking about the retail cost of a drug. And that's how we reach this this arbitrary number of 4430 at the bottom. That 4430 is the maximum that you'll pay in that stage. And once you hit that, you'll fall into what's called the coverage gap or donut hole. And that donut hole then is a cumulative of costs. Again, you pay 25% for insurance. And once your cumulative for the year reaches $7,050 of the member and plan pay, then you'll fall into catastrophic, in which you'll pay the greater of 5% or $395, $995. So that's those are the 4 stages of Medicare Part D. We can go into that. A lot of people won't hit that because of the drugs levels, but it's definitely something that you want to be aware of if you have many drugs. So, my job is to make sure that I compare all the carriers' costs and medications. We'll get that together if you want to use me. I would love to review your drug list and put this together, and then find out the best combination of premium and total cost. All right, so that's A, B, and D. So now let's get into the coverage of the 20%. So what does Part A and B not cover? So if you had original Medicare and you had that 80-20 situation, what things can you expect your original Medicare A and B not to pay? Well, they don't pay for acupuncture, they don't pay for chiropractor unless it's driven by your primary care physician. Doesn't pay for the nursing home. Now it covers the medical part of the nursing home, but it doesn't pay for the custodial care or the cost or the rent, the room and board. So when you have that, you want to make sure you have long-term care insurance for that. But the nursing home is not covered per se, but the medical side of your individual is covered. Dental, vision, hearing, that's not covered by Parts A and B. Emergency medical care outside the United States is not covered. So if you go out of the United States, you'll want to get some separate insurance for that, travel insurance or anything like that for emergencies. And I think both the Medicare supplements and the Medicare Advantage plan may cover that. And then the prescription drugs we just talked about, that is not covered on that as well. So, all right, so what is covered? So let's talk about what we can get to protect that 20%. And this is the key part of what I do for you. The other part, you could do that all by yourself. You can get A, you can get B, you can even get D if you wanted to, but it's easier if you use me because I can do all of them together, and so it's just less of a hassle. But technically, you could do that by yourself. The part to protect that 20%, like I said, if you get into the hospital for 3, 4, 5 days, nowadays that might be a good $20,000 or more of your percentage. So we're trying to protect that 20% risk, and how we do that is 2 ways: the Medicare Advantage plan, formerly known as Part C, and the Medicare Supplement plans. Let's talk about the supplement plan first. Have you ever seen that commercial? And I'm sure you have, because you're all my age or more, but the Fram oil filter, which was that said, pay me now or pay me later. And the pay me now and pay me later was a negative on pay me later because you'd have to do more things and pay for more parts if you did later. But in this particular case, it's the mindset of pay ahead of time for services or pay as you go. So if you think about that framework, there isn't a wrong answer when we talk about the difference between Part C and supplement plans. There's not a wrong answer. The right answer is what makes you feel best about your individual insurance situation and medical coverage. What makes you sleep at night? What makes you feel better? Maybe what kind of a person are you to know what medical costs are going to be ahead of time? Or I know I'm not going to pay anybody until I get there. So that's the 2 mindsets and between your heart and your brain of how you visualize this. So let's talk about the Medicare supplement plan first. So this is like it's called Medigap, fill the gaps, Medicare insurance, Medicare supplement. That's all of the ways that you pretty much hear this, but this is the gap insurance, and the gap is the 20%. So this is private insurance, so that means that it's separate from Medicare, it's separate from the Medicare Advantage plans, and basically what they do is they're in tandem with original Medicare in paying the bills. So if you go to a service and have a service done, and it goes to Medicare first. They pay 80%. Goes to insurance, Medicare supplement. They pay the other 20. This is another benefit of this is you know your cost ahead of time. So you have an annual cost set up, and in that annual cost, but the monthly premium is based on annual cost. So you know exactly what you're going to pay for the whole year. So let's talk about the choices. So the choices are F and G. And if you work with me, those are the only two choices I'm going to recommend. And the reason for that is that if you turn 65 before 2020, in other words, if you're if you're in 67 range, I think is what it is right now, 67, 68, you still can get Plan F. But after that, after 2020, you can only get Plan G as the best plan. The reason that we do the Medicare supplement plan is because it pays the gap. There's no reason to go anywhere else because you're going to do co-pays or half insurances and stuff. And if we're going to do that, let's make a Medicare Advantage plan work. So if you're going to do a Medicare supplement, I recommend you do the F or the G plan. Let's see why. So if you look at the top here, you can see Medicare Part A coinsurance, and you go across, it pays 100%. What that 100% stands for is 100% of the 20% left over. So anything Medicare Part A doesn't pay, the plan pays 100%. And Medicare Part B coinsurance, the plan pays 100%. The pint of blood, 3 pints of blood, hospice care is 100%. Skilled nursing facility, that's when you break a hip and you have to go to rehab. The first 20 days, that's paid for by Medicare. The 21st day through 100 days is paid for by you. And so you need to have, this insurance covers 100% of day 21 through day 100. If you get a Medicare Advantage plan, just as an aside, it pays you have to pay $184 per day from day 21 through 100, and at least 21 through 50, because some of them have stopped after 50, 55 days. So anyway, so the difference is you're already paying for all of that 21 through 100. Part A deductible is about $1,500. It pays 100% of that. Part B deductible pays 100% of that, but that's only $200 and $203. That may go up a little bit next year, but currently it's at $200. I think it was 183 or something last year, so it might go up $80 or less, but something like that. Anyway, so that's all you have to pay on top of your premium to do Part G or Plan G. Here's another one reason why I would recommend F and G all the time, and if you want to supplement and that's something that's right for you, is that Part B excess charges are paid at 100%. I've never really heard of a more vague term in my life as a Part B excess charges. That's Part B, which is doctors, and it's excess charges, which I don't like to see. So if I'm protected 100% by that alone, that's worth getting into a supplement just for that. So anyway, Part B excess charges are paid 100%. And remember, we talked about travel. That's not outside the United States. It's not covered by Part A and B. Foreign travel emergency is 80% covers in emergency situations. So you're 80% of what you need in that. So that's 80% of the total. Remember, Part A and B doesn't pay for anything outside the United States, so that's pretty good. So basically takes over for Medicare. All right, so F and G are standard. Those are standard plans, and so the people that do the standard plans have to give the exact same thing. So Plan G, every Plan G is standardized. Every Plan F is standardized, even though they're being weaned out. But Plan Gs are all standardized, which means the benefits of a Plan G will be the same regardless of the company you select. So don't look at the logos, look at the price, right? Because everything they have to do the same by law is they have to cover the exact same things, and they can't offer any other benefits. So the Doctors Network, this is the beauty of these plan supplements, is you can go to any doctor that takes Medicare, that's contracted with Medicare. You go to any hospital that's contracted in Medicare. So therefore, your network is nationwide. So this is the HMO or the PPO in this particular case is the whole country. So if you think about that in a travel perspective or a retirement perspective, I could live north for 6 months, I could live south for 6 months, I could live in an RV for 365 days, and I would be covered. The claims process is becoming more automated, as you can imagine. I give a bill, I send it to Medicare, it goes over to the private insurance, they pay it because it's already been approved by Medicare. It's pretty much a simple process. So how do you pick it? You pick it by price, pick it by company, pick it by history. Now, the reason you pick it by company is hopefully the logo is somebody that you've heard of. So we always want to be in something big enough that is a reputable company. And history is between you and me. If I have bad experiences with a company, I wouldn't recommend it, and as well as you. If you can't sleep at night because you hate Aetna, we're not going to get Aetna, and that's kind of how that works. So that's how you pick a Medicare supplement plan. It's less risk than no coverage, and it is a little less risk than the MA plans. We'll talk about that. Medicare Advantage is MA. 99% of the doctors take it. Any doctor that accepts Medicare accepts this insurance. And remember, you have to get Part D if you get this Medicare supplement. So that's that one plan for $8 or $17 or whatever that is, whatever we come up with for your Part D. So if you get a supplement, it also includes that. I did some preliminaries on people who are turning 65 across our couple states that I'm in. And it kind of ranges in this range. So if you thought this was going to be really expensive, that's relative. So $119 to $127 is about the area. Now, that's not guaranteed. So don't yell at me if you're $97, or don't yell at me if you're $135. But this is kind of the sweet spot of a Plan G for our area. So that's just so you know how to figure that out. So if you take that number, where's my calculator? If you take that number and you multiply it by 12, so 119 times 12 is $1,428. If you add the $200, which is deductible, that's $1,628. That's your maximum out of pocket on a supplement. So if you got your supplement for $119 a month, your maximum out of pocket for medical will be $1,600 a year. So that keep that in the back of your mind. All right, so the next part is the plan formerly known as Part C, Medicare Advantage plans. Now, Medicare Advantage plan is the pay me later. Now, remember, there's no wrong answer here. This is just a different frame of mind. It's a frame of mind that says, I want to save what I'm paying ahead of time in a supplement, and I'll wait and have it later. So that is the Medicare Part C. And it's basically a copay. So you're paying as you go. So a copay to go see the doctor. If you go see a primary care physician, it's nothing because most of the plans are zero. But if you go see a specialist, it's $35 to $50, anywhere in that range. Remember, Part D, the drug coverage is included, and that's why they formed a Medicare Advantage, was to say, the advantage is I've got everything together, and it just keeps building from that. And if you've ever watched TV in fourth quarter, you'll see Joe Namath and Joan London. They're all over the place talking about all the benefits that happen in a Medicare Advantage plan. Well, one of the benefits is that the premiums are going to be zero. Now, not all of the premiums are zero on every plan, but in most of the cases that I do, I try to stick in the zero because I think there's enough coverages in the zero to make it work. So we can go outside of that if we want to, but most of them are zero. One of the reasons that Medicare Advantage plans are becoming more and more exciting or palatable, if you will, is that they're giving away money, and they give away the money in the benefits of dental, vision, hearing, over-the-counter credits. And so those are the things that are becoming more and more enticing to get people to come into a Medicare Advantage plan. And you can think about that. If you've gone your whole life with a great dental plan that cost you $20 or $20 a month, and a vision plan that didn't cost anything, you can imagine that if you had to pay $59 or $60 a month for dental and vision and not hearing, and you didn't get any over-the-counter drugs, that maybe this would be a little bit more enticing. And dental can be. I mean, the dental plans are getting better. It's up to $2,000 I've seen in some plans, down to as low as $500. Vision is about 150 to 200, something in that range. So you can get a pair of glasses and frames with that vision. And usually in both those situations, the exam is part of the deal. Hearing aids, there's a couple ways they do that. They do it either in a copay where you pay the first $600 and then the rest of the $4,000 hearing aid is on you, or on them. And then the other way is they'll give you $1,200 per hearing aid, and that's another way of looking at it. Over the counter is just basically giving you money in a catalog and saying, here, get some vitamins, get your aspirin, get your whatever you see on the other side of that counter could be in that catalog, and they're just giving you money. And that ranges from zero, I mean, some of them don't do it, to $25 I've seen a quarter, to $100 a month. So there's a huge range. And the reason there's a range is because each of the companies get to pick where they put their benefits. Is it better to do a hospital, or is it better to do premiums, or is it better to throw it into the benefits of dental and vision? So here's the kicker. So remember we talked about that $1,628 from the Medicare supplement side. Well, the risk on this side is the maximum out of pocket would be $7,500. That's the highest. Now, every plan is not $7,550. Some of them are lower. None of them get below, I don't know, $35,000 or $4,000, but this is the highest that they can go. And this is in network. So if you're not in network, this could be as high as $15,000. So that's the range of that. So it is a little bit different. Now, the risk is your risk assessment, right? Risk aversion. If you feel like you want to just go with it and pay as you go and keep that money in the bank and say, if it happens, I got it, I'm covered catastrophically, then this plan is a better one that works for you. Here's how you get to that maximum out of pocket. Now, I've seen something last year that said that most people don't even get to their maximum out of pocket. It's hard to get there, and you have to get there on a really bad year, or you're already in a bad medical condition. But let's say you break your hip, and you go to the hospital. This is how it's assessed. So something like a $325 a day for the first 5 days, and then the next day, the 6th day through the 100th day is no copay. So that's $1,600 right there. To get a ride to the hospital in the ambulance costs you $300. The ER costs you $90. All the tests that you do. Remember the skilled nursing facility. If you go to rehab, remember that's $184 a day after day 20. So that's how you build up to this maximum out of pocket that could possibly happen. The other thing that you can get there is cancer. So unfortunately, if you get cancer, they're going to get that maximum out of pocket pretty quickly, because it doesn't. Cancer treatments or chemotherapy is a Part B coverage. So that's the only place that Medicare covers drugs. And in that chemo, they'll pay the 80%. So let's just say it's $10,000 per chemo treatment. I don't know if that's true. It might be lower, but it's easier math that way. If it's $10,000, that means they pay 8 and you pay 2. Well, you can say after 4 treatments, you're already at your maximum out of pocket. So you paid that. So one of the things that I do to help offset that, to make this Medicare Advantage plan work, is I build in an insurance on an insurance. So I put in an insurance that covers the bigger copays all across the board on the hospital, the skilled nursing, the ambulance, the MRI, things like that, for the lower amount of the 60 to 70. And then I put a $15,000 cancer insurance on top of that to help on those copays for the drugs, because the drugs don't have a maximum out of pocket. So that's just a way that I make a Medicare Advantage plan more palatable when you do talking about this pay-as-you-go. One of the negatives that's been over the years has been the doctor's choices, and that you have to stay in an HMO, you have to stay in the network. This is broadening. So they know that people aren't coming to this plan because of that restriction. Now, there are HMO plans, and if you get an HMO plan, it is restrictive to that network, because that's how they get a better deal. The doctors will play in that arena, and they'll come to them only. And if you go into a PPO, which basically is a wider net of the same network, so like a wider net of Aetna, or a wider net of Cigna, a wider net of United Healthcare, and you're allowed now to go a breadth out, make it a little bit broader, and you won't have to pay as much. Now the difference is that you pay a certain amount when you go to the doctor, which is $0 if you're in the network. If you go outside of the HMO network and go into a PPO, you may pay a little bit more to see that same doctor, or specialist rate, as opposed to the $0. So it might be $50 instead of $0. So they are going to charge differently throughout that PPO, but it is a wider net and it is covered. And I think that's the point, is they're making that coverage a little bit broader. So that's how you would work a Medicare Advantage plan. I talked about that $60 and $75, and this is kind of how that hospital-wise works. That I will do it by plan, but let's say that the confinement was $295 for 6 days. The plan that I put on top of it is $300 for 6. So every bit of the big ones get covered, and these are the list of the ones that we've covered: the ambulance, the emergency, skilled nursing for all those 80 days, any kind of diagnostic exam. And on the left side, we'll tell you what the Medicare Advantage plan copay would be. On the right side, it would be what this extra insurance would cover. So it's just a way for us to make that Medicare Advantage plan work. So the last slide of any kind of consideration is, how do you make a choice? And you make a choice, hopefully, maybe in your head, you've already know it, because I'm a person that likes to know. I pay things in advance. I want to know how much my maximum out of pocket is going to be before the year starts. Maybe I'm a person that says I'm not paying a doctor anything until I get there. So that's the way that you're going to decide this. But if you look at expense, flexibility, and lifestyle. So expense is pay me now versus pay me later. We've gone over that. Flexibility is how you can see doctors, and you can go to anyone that accepts Medicare, even in hospitals. For Medicare Advantage plans, it's broadening. It's not as big as Medicare subs yet, but it's broadening. And if we want to do a Medicare Advantage plan over sub, we're going to do that comparison for you. And the biggest thing that I would never do is push you on a plan that doesn't have a Medicare, that doesn't have your doctors on it. And the last thing is the lifestyle. So beneficiaries who travel, like I said, if you want to go north, go south, you can go all over the place for the Med Sup. You got to stay around your Medicare Advantage plan to a degree. So you either go original Medicare, go Part D and a supplement, or you get a Part C, a Medicare Part D, and then maybe some ancillary insurance to help you cover up that bigger copays. And that's Medicare. I know that's a lot of information. I'd love to answer questions either now or individually. And I know that someone will have a mic here in a second, but just to know that I appreciate your time. And I love to talk about this, as you can tell, and I would go into more detail, even more, if you have more questions. And then, like, this is my contact information that you can write down. I'll have that on there until we're done with the questions. Go ahead.
Hey, Jeff,
sorry, Mark.
That's okay. It's Jeff, actually.
Oh, hi, Jeff. How are you?
Great job. This
Jim.
stuff is complicated, but we're grateful that you're willing to spend the time and walk through it. We do have a few questions. If anybody has a question, you can either type them at the bottom there in the Q&A, or email Jim, or call him, or call our team or Mark's team and let us know how we can help. But there were two that I thought would be good to share. So the first one is from Gail. So she got an information pamphlet from Blue Cross Blue Shield of Tennessee stating that her prescription drug coverage that she has is considered non-credible coverage. She's 62. Does she need to do something now, or can she wait? And why would she notify by them that when she was shopping for that? Any insight there? You're on.
I think it's because she was shopping, and maybe she put in what she had. But it's important that you don't have to have credible insurance before you're 65, but because you're going to have credible insurance when you turn 65. But if you get on Social Security beforehand, maybe they want you to have credible insurance then. But there's ways to get that covered if you want to go in a different route. I can't believe that Blue Cross Blue Shield of Tennessee would not have credible coverage unless you went to a lowest level or something. But I can talk about that individually. I can analyze your situation and anybody else's situation if you got that as well. But it seems to be an individual situation that I can dig deeper in with you and help alleviate that and figure out what the issue is.
Okay, great. Next one is just, could you explain how the fees, or how are people in your world paid from the insurers?
Yeah, here's the good news is that working with Southwestern is my privilege. And even though you might think that this isn't worth a dime, I'm just kidding. I love working for Southwestern, and it's all gratis. Everybody that works for them, whether they're a client of mine or not, I would love to help. So just remember that I will help anybody. And the way I get paid is if someone enrolls to one of these plans that you saw, the Medicare Advantage plan or the carrier or the Medicare Advantage or the supplement, I get a commission from them. So everything is a way. So you can work with me all you want. That's why I love this company, because I'm a Medicare advocate. I can work with all the companies and we can find the best situation for you and not worry about, oh, they give me more over here and it doesn't matter. This is all part of the making sure that you feel comfortable when you move into this Medicare world.
Okay, good. You mentioned the $148 a month for Medicare B. That's per month per person. Is that correct? So roughly $300 a month for a couple.
Yeah. So the great thing is all the way until 65, you were a team, you were a family, and it was great. Now in Medicare, you're separated. It's all based on your Medicare card. So everybody has to pay for that Part B separately.
Okay. And the last one so far is sign up for Medicare Part A when you turn 65. Do you have to do that even if you're still working and you have coverage through work and you're not signing up for Social Security?
No. The reason people want to get that is because they're entitled to it. If you've paid your 10 years and 40 quarters, at least, you're entitled to Part A, and some people like to do it. I think Medicare probably wants you to do it too, so they can get you started in the system and know where you are, but it's not a law. You can get into it whenever you want to get into it. Sometimes it's just another thing you can add to maybe what you don't pay on your insurance, but no, you don't have to get it. You can wait till you're done with your insurance to get everything.
Okay. Along those lines, though, it is interesting. We've had several examples of where people are on group employer coverage and they're better off to go to Medicare. And so at least it's a good time at 65 to start to analyze and see if they'd be better to do Medicare sometimes
Yeah,
the premium be cheaper.
Yeah, and that's what I do is I put together all the costs, and I couldn't show those. My sales leader said it wasn't legal to show you all the details of what I put together because it had actual costs on it. But I put together cost examples between the Medicare Advantage plans and between all of the supplements, so that we can look at one sheet of paper, see how those expenses come together, and then you work with Jeff's team and Mark's team to determine how that fits in and what level you're best at. So that's what I do for you, and I think it's very helpful to give you an idea of what's coming.
Good. We had a person that is on Medicare, but it didn't pay for their yearly physical exam. Is there any insight you can offer on that?
Well, I think it should have. If you get any of those, if you get on your supplement, that's all paid for. So if you want to get on a supplement of a Medicare Advantage plan, the yearly physical exam is paid for. I don't understand why it wouldn't be, but if you want to give me a call, we can look into it more. But I would challenge that, and I would just say why it wasn't, because the purpose of Medicare, and this is why it's hard to believe, is that they want you to be healthy. In 2022, you'll see a lot more care managers and people who want to say, where are you now, and what can we do to make sure you stay healthy? I wouldn't understand why they wouldn't pay for that yearly exam.
Yep. Okay, good. Well, that's all the questions during the Q&A, but if you have any questions, if you'd either please call Mark's team, call our team, or call or email Jim. This is it's a complicated topic, but it's an important one. And I guess the last question, is there a way that you could turn off all the postcards and mailings that are being sent to everybody in the next couple of weeks?
Yes, ignore them and call me, because it's good to find somebody that is calm about this, is not going to push you into something you don't want. And I understand that, and I'm very compassionate to that. So I know I can't stop the mail, but hopefully if you need somebody that's going to talk you off the ledge, I'd be happy to do that.
Great. Jim, thanks, my friend. We appreciate you, and thanks for everybody for joining. Let us know if you have any questions.
Thank you, guys. I appreciate the time, and I appreciate your. Yep. Thank you, guys. Have a good one.
Day.
All right.